Good morning, everyone. Kevin Henderson, Grayson County Judge Executive. We just wanted to come to you today to try to address some of the issues that has been going on with the coronavirus and the impact it's having on our community, our state, and country. We've got some local leaders together to try to pass along some very good information to you from the hospital, the health department, and some other agencies, and some things that we've got going on here in the county. So first up, I'd like to introduce the CEO of Twin Lakes Regional Medical Center, Wayne Merriweather.
Thank you, Judge, and good morning, everyone. Let me start off by saying one of our physicians described what we're in right now as like the calm before the storm, a really bad storm that you know is coming. And I thought that made a lot of sense. You know, we're preparing as best we can. And we spent a lot of time over the last week or so doing that to make sure our hospital is prepared to take care of our community and our patients. And as all of you know, information is changing by the hour. It's a very fluid situation. It has been for at least a week, maybe two. The requirements that we need to take into consideration are changing very fast at Twin Lakes. And let me just say, I want our community to understand that we are prepared. We have our plan in place to address COVID-19 if someone presents with those conditions, and then how to treat them, and how to protect our medical staff and our employees. It's all very important. Let me just say the latest that you'll see, there were some visitor restrictions implemented last week. Tomorrow we will be implementing more strict visitation guidelines. And here's what they will be. What they won't be, we won't prevent you from coming to see your doctor. You can still do that. If you're having an outpatient procedure or another surgical procedure, you'll be able to have those as planned. If you're visiting someone in the hospital, that's going to be different. If you're having a baby, that will be different. You'll be allowed one visitor with you, and that has to be the same visitor. It can't change. Then if you're 18 or under, you can have a visitor, and that visitor has to remain the same one. If you're a patient in the hospital, we're going to do the same thing as the long-term care facilities, and there will be no visitation with the exception of end of life. Now, and then everyone coming into the hospital will be screened. We're going to limit our entrances to the front entrance, to the emergency room entrance, and to the Cave Bland entrance. And beginning tomorrow, there will be screeners there screening for temperature and other issues. It'll be very quick. We hope it won't take long, but it will be an inconvenience, as many of the things that we've had to do over the last few weeks have been. But I want our community to understand how serious a situation this is. And we're just in the beginning phases of it. It's going to be with us for some time. We haven't had a positive patient in our community test positive, but we expect that. There may be folks walking around now that are positive that we don't know about. So we're having to take those precautions. And the reason for these stricter visitor and patient entrance requirements, we want to protect our patients and we want to protect our employees. What a lot of you may not realize, if an employee gets exposed to someone that tests positive, or if a physician gets exposed, they have to be off work for 14 days. So it's easy to see that we could not have the workforce that we need to take care of our community if folks get exposed. So we don't want that to happen. And then secondly, we want to protect our patients. We want to limit access to the hospital. only, no vendors will be coming in, other type of folks. So we can limit that and try to protect our patients from being exposed. Some other things I might just touch upon. Our capacity is fine right now. That's one of the concerns throughout the country, is to make sure we have capacity to handle patients when we start seeing them come in with this virus. We've talked last night with our medical staff. There's been a recommendation by the governor to limit or stop elective procedures, and that's twofold, to make sure you have capacity and you don't use up all your personal protective equipment. So capacity is not an issue right now. Our census is relatively low. Supplies are another issue. Due to limited availability, we're getting about 60% of our supplies. But we do have those supplies, those masks, those gowns necessary to take care of our patients. And we'll continue to get that allotment, but just on a limited basis. We're going to follow the guidelines set forth yesterday by the Kentucky Hospital Association regarding elective procedures. We'll be reviewing each procedure by a surgical committee team that was established by our medical staff last night, made up of surgeons, and any of those that can wait may be postponed, but any that are emergent, of course, or life-saving, those will continue. With that, I'll just open it up, see if there are any questions. I will say that appreciate the efforts of Judge Henderson, by Doug Robinson, our school superintendent. We've been pretty much in daily contact with Josh, with the health department. I know at the hospital we're spending most every bit of our time dealing with this coronavirus to make sure we are prepared as much as possible. Yes?
You said y'all will be possibly limiting elective surgeries. Are you all asking the community at this point to delay elective testing and procedures like mammograms that are just routine, things like that, or to try to keep people out, or?
No, I mean, we're not asking people to do that. We know that needs to continue for now. It may come to that, but we will screen them and see if there are any issues. Those folks will be screened just like anybody else coming into the hospital. And if we identify an issue, then, we'll do something different. We're a little bit unique because we have physician offices along with the hospital. But no, we're not preventing anybody from coming in for testing at this point. We want to continue that.
The surgical procedures involve more. It involves a lot more people. It involves a lot more equipment, a lot more gowns, masks. So that, I think, is part of the reason.
Mm-hmm.
Mammograms are a simple procedure, so it doesn't involve that. It doesn't involve somebody having to wear a mask and gown. Well, the woman wears a gown, but
Yeah.
I mean, the provider doesn't have to gown up and.
Okay.
Any other questions from you all? Okay. Thank you, Wayne. Appreciate it. Next up, we was going to go with Josh. Dr. Lee was running a little bit late. He's celebrating St. Patrick's Day with his Notre Dame pants on, so that's good. We're going to go ahead and let Dr. Lee speak a little bit about the virus, and I wanted him to come to let people know, to reassure them everything's going to be okay. Just take certain precautions, to protect yourself. And I couldn't think of anyone better than Dr. Lee, since he's been probably 80% of everyone's doctor in the community. So without further ado, Dr. Lee.
Thank you, Kevin. I was Kevin's doctor. I don't know if I was 80% of the people in Grayson County. So about a month and a half ago, we had our first case in the United States of COVID-19. We didn't know what it was going to mean. We knew the potential was there that it was going to be bad because China had been very bad. Since then, Italy has been very bad. Korea has been medium bad. And the United States is ramping up. And it's all of these steps that have been taken, and I'm not sure what Wayne had, what all he had said, but all of these steps that the government and our governor is taking are necessary to level out this peak of cases that we're anticipating getting. So stopping schools, which, have you talked already, Doug? No. Okay. So the stopping schools, the now not closing the restaurants except to carry out, and all of that is important to minimize contact with other people. So what we want people to do, one of the main things we want people to do is to stay home, to minimize who they're in contact with. Getting outside is a good thing, but we don't want you to get outside and go to the concert or get outside and go to the parade, because we're not going to have those until this is settled down. So it's an inconvenience to everybody, but I think it's going to pay off. We're hoping that we're not going to see that peak they saw in Italy, where it was overwhelming to their hospital system, and that is one of the things that we're gearing up for, but our country isn't prepared for that if it gets to be what happened in Italy, where they just had overwhelming number of people over a 2-week period that were critically ill. And if we can avoid that and keep that number at a level that we can handle, and I think our hospital is prepared, but we do have a limited number of beds, and we would like to limit that. You've heard this probably multiple times the last month. In addition to the social distancing, which we want to do, you want to be sure that you're washing your hands more than you've ever done it. Cover your coughing if you're coughing. Don't use your hands to cover your cough. Cover it with a tissue or your elbow. Clean surfaces off that might be touched by hands. We want to be as cautious as we possibly can. I was glad that we were one of the last churches that closed, but I was glad our church kind of got the message and it did close. So I think most of the churches are closed, and God doesn't want us to stop praying, but He wants us to not be next to somebody while we're doing it. We're a little anxious what this is going to mean in an office, because we have not had a lot of tests yet, and we don't know how many people are out there with this. But when the test ramps up and we're doing more testing, I think it's going to be difficult probably to keep up with it. That's why if we do the social distancing, I think that will keep that number at a controllable number for both our offices and for the hospital. So we're all kind of ready for it, but it's an unknown right now. It's a very real thing, though, because we've seen what it's done in other countries. I'm happy to take questions if anybody has any questions.
Maybe y'all got any questions for Dr. Lee? No?
Okay.
All right. Thank you, Dr. Lee. Next up, we have Josh Emery. He is actually the director of the Grayson County Health Department, and he will let you know what's going on there and at the state level with the health department there. So, Josh, thank you.
Okay, well, Dr. Lee has highlighted about the testing situation in the state right now, and I just wanted to talk a little bit about that because I feel like there is growing frustration, not only in Grayson County, but in the state and in the United States. And the problem is right now with the tests that we just don't have enough capabilities and enough of the products that we need to conduct those tests. So hopefully we know we have the commercial labs that have now signed on. They're ramping up, and I know the state lab is doing everything it can to stay ahead of the game and try to test as much as possible. But again, your patience is very important. We're working very hard to try to initiate as much testing as we can. The next thing I'll say is, the health department has been working tirelessly with our community partners to make sure that we are keeping the community informed. And that includes collaborating with state government officials and echoing the voice of the governor himself. Dr. Lee mentioned social distancing, and I think as a millennial, I think this has been one of the most difficult things I've had to face as an interruption to my daily life. I like to go out in the morning and get my cup of coffee. I like to shake hands. I like to be around people. I'm a people person. So this is very difficult for me, but in the grand scheme of things, it's very important that we follow the governor's instructions, the state's instructions, our local hospitals' instructions, and our county government's instructions, and making sure that we are doing everything we can to prevent the spread of this harmful virus. The next thing I'll say is we talked briefly about hospitals becoming overwhelmed. The government has addressed a plan to try to mitigate this as much as possible. And the best way to do that is with social distancing. As you space yourself out, you are preventing this disease from spreading. And in turn, that gives hospitals a little bit more time to prepare, as well as it spaces the infections out so they're not overwhelmed all at once. So there's not a spike in those infections. So when we say social distancing, that's why it's so important, and that's why we are preaching it so much on the healthcare level at this time. The next thing I'll talk about is some changes we've implemented at the health department. Effective Monday, we will be implementing temporary hours, Monday through Wednesday, 7:30 to 4:30, Thursday, 7:30 to 4, and Friday, 7:30 to 11:30. And the reason is for this change is because we have changed our clinical services, and it just made sense to adjust our hours as well. The next thing I'll say is we have also implemented a change with WIC. So if you're a mom or a dad out there and you're depending on WIC services, we have said that if you're up for renewal of those services, that basically we can load your card for 30 additional days. We will then call and reschedule your appointment. Our HANDS program that sends workers out to people's homes to mentor new moms and dads and kids will also be implementing changes, and we'll be announcing more about that later this week. But just to give you a window into what we will do, basically we're going to be relying heavily on the phone to talk with those families instead of doing face-to-face. We don't want to preach something and not practice it within the department itself. So the last thing I'll say is I'm very confident in the individuals on or behind me. I had Dr. Lee as a doctor as well. He was my pediatrician. I know that Doug is doing a great job at the schools. Wayne has a heart for the hospital, and I know that Kevin is doing a wonderful job, Judge Henderson, at making sure that the county takes this seriously. Thank you.
Thank you, Josh. Next up, we've had a few calls here to my office, and I know Doug and them has too, with reference to the schools being closed and with the Meals on Wheels and what's going to happen later on in the future here. Of course, we're in uncharted territory, so we actually don't know at this point. So I'll let Doug go ahead and get up and speak a little bit about what's going on with the school system and how everything needs to be working as far as the students go and this and that. So Doug?
Hey, well, thank you, Judge Henderson. And let me start off by saying thank you to our healthcare community. They're on the front lines, and I'm just not talking about Grayson County, Litchfield, but statewide and throughout the United States. I mean, I've been involved with several meetings with all these folks over the last few weeks and pretty impressed with just how we're jumping in and getting prepared here for each community. So thank you all to all of our healthcare workers and first responders. And also thanks to our community, when Governor Beshear last week basically closed the schools down, I was just overwhelmed with the support from our community and our parents of what do we need to do to make this happen. And whether it's starting with our non-traditional instructional days, we sent packets home, and some of them's on technology-wise at the high school and the middle school. But hopefully those days we'll be completing work that we won't have to make up for now. And everybody, the burning question I've gotten this morning and yesterday is, how long is this going to last? I have no idea. We're preparing for anything from our 4-week shutting down, including spring break, to 4 more weeks. I have no idea what that will turn into. But hopefully if you have some questions about the NCI program and the instructional work, just contact the school, somebody at the central office. If you go to GraysonCountySchools.com, Karen Lewis has done a wonderful job of a resource page there. It will link you. Even our district website will get you to the work that the students need. And there's also some resources there, the CDC, also about some resources of how do you talk to your student or your kid, your grandchild, or whatever about this virus. Also at our schools, we have been working on having access to our staff. If you call the school, some parents have come in and said, don't call me every day, don't call me every week, I'd rather be emailed, you can text. We're trying to work with those different scenarios, but if you have any questions, call out to the central office or your particular school and we'll be able to answer those. With our food service program, I cannot be more proud of getting that off the ground yesterday. I mentioned to the group we had 441 lunches served yesterday in Grayson County through our mobile bus routes. And some of those will be flexible on if there's a need. You can contact your school or some of our food service employees, and we'll try to make that happen as well. But we have some of our transportation department manning those 6 bus routes on a daily basis, and our food service are preparing those meals, and we're also serving different times at the school level for breakfast and lunch. If you go to GraceCountySchools.com, you can pick those schedules up, or if you don't have access to that, you can call us and we'll be willing to get you to where you need to be. And again, just so supportive, appreciative of all the support that we've gotten to pull this off. And our staff has worked tremendously last week of getting these packets home and trying to keep the students occupied over the next few weeks. But I'll take questions from anybody. Anything I didn't address? Anybody? Anything that? All right. Thank you for the opportunity.
All right. Thank you, Doug. First, I just want to say I've got a lot of different resources here that I want to let people know about. It's mainly for this. While we've done this, we've had some people call and want to know about different things. We've got a lot of resources that's in the county. Grayson County Alliance, which is the food pantry. You can visit them at gc-alliance.com, gcalliance.com, and they deal with heating assistance and that's community action. I'm sorry, that's community action. And they deal with heating assistance and that type thing, and utilities and all kinds of different things. And I have got a spreadsheet here of phone numbers for the press to actually put into the paper and to put on, on the K105's website of different people that we can call, that gives you those contact information for these different agencies. Like I said, we've got Community Action. Theirs is actually ckcac.org. You can visit that, and they actually do, what they do is the senior centers also. And where we've had a lot of people ask, how are we going to get food to our seniors and this type stuff. And they actually do that at 102 Watkins Wood Drive up at the senior center. And they're doing drive-up only right now, drive-through. If you're not a member of this, you can call, and they have to fill out just a small amount of paperwork to get you set up with it, and that number is 259-4885, 259-4885. And on electric bills, utility bills, and that thing, I haven't heard anything from the city or as far as Grayson County Water District yet. But electric bills, I know KU and LG&E has put out that they won't be doing any disconnects or anything like that. And I just suggest you that you follow their website or their information and let you know a little bit more. WRECC has not let us know anything yet. I'm sure they will shortly, maybe today. I talked to Harold Miller this morning. He said they hadn't made a decision on what they're going to do yet, but I'm assuming they're going to probably do the same. County offices, what we have, the county attorney's office is not taking any public traffic into the area, and they are going to be remaining open. The staff is there, but if you need anybody with the county attorney's office, you'll be able to call and contact the county attorney, Jeremy Logston. He'll be happy to answer any of your questions. Circuit Court Clerk's office, as of yesterday, they was still doing driver's testing, but that has since been canceled, and they are driver's license renewing only. And we suggest that you call reference to court dates or anything of that nature. That's going to be done by, that'll be handed down by some of the circuit court judges on how they handle the court and the court dates, and I think they've already put something out on that. But if you have any questions, you can call the circuit court clerk's office, 259-3040. The jail, jailer Jason Woosley, all traffic has been, all visitors and has been stopped in the jail. The work program has been canceled at this time, which affects a lot of these other agencies that we have, like Community Alliance and the Grayson County, the Food Pantry and the Community Action, and a lot of different agencies that we have here in the county, because we really depended on those folks to help us out. So Jason has completely done a restaffing of some of his people that was doing things, and we're trying to help the food pantry out with that, so people can get food out there. As far as the food pantry goes, their plan this week, if you've got any questions with the food pantry, you need to call 270-259-4000. They are doing a drive-through only at this time. If you're not set up with them, just please give them a call. Debbie's great to work with. She's even said no one has to go hungry in Grayson County, and I'm truly behind her with that. There's no reason for that. And basically, I wanted to talk about the Meals on Wheels, which Doug has already covered. And Doug, if someone needs something else in an area that you all don't go to, or y'all just have them call the office.
Yeah, call the office, and that's a fluid route. That was a starting point. Some of that was based on our particular routes that we had this summer and the turnout, the need at that time. So yeah, we've made some adjustments. As the week goes on, we'll make it happen. Just contact the school or the central office.
Yeah, basically, and if you couldn't hear Doug, he just basically said contact the school. They will make arrangements to try to get in your area. They've covered, this is online also with Grayson County School meal pickup. So only thing you got to do is get online, or if you don't have access to internet, surely we know somebody that does have it, and we can get you that information. Or call the main office at the Grayson County Schools. I've went over a little bit about community action with the seniors, and they also they do the CATS program, which is the transportation to and from the senior center, and they also help the seniors with transportation to the doctor's offices in different locations. At this time, they are still continuing to do that. There's a number you can call, 1-800-242-8275. Check, 8225. That's 8225. 1-800-242-8225. They are still, at this time, as of today, they are still providing that service to the community. That is the CATS vans for the seniors that a lot of folks use here in the community. Grayson County Library is actually closed to the public. They will tentatively be opening on April the 13th, which is basically when school is supposed to start back. But at this point, everything that we have been seeing and doing, everything's changing from hour to hour, so we'll try to keep updating you on that. So as of this time, though, the library is actually closed. I think you can pull into the parking lot and actually still get onto the Wi-Fi, I believe. So, but as far as going into the building, you can't access into the main part of the building. And the Grayson County Clerk's Office, where you do your registration for your tags. As of 4 o'clock today, that office will be closed to the public. You will be able to access online to renew your tags. They are still doing mail-ins, but as of right now, that office at this afternoon will be closed to the public, and a lot of this, folks, is coming down from the state, and we're taking their recommendations on what we need to do. So I know it's going to be inconvenient for a lot of folks, but we're all in this together. We've got to buckle down and do what we need to do. The sheriff's office, Sheriff Chaffins, is still going to be taking complaints as usual. Their office, their lobby will still remain open. He just requests that everybody be aware. It's 10 people or more, so if you see quite a few people standing in there, just please be aware and be courteous and wait till some folks leave. PVA office is also going to be closed to public use. They also have a website. If someone needs to do some research, you can get on the website and look at Grayson County PVA. And we're going to try to update the website that we actually started this weekend to some links that with the PVA office, and to possibly link to the county clerk where you can renew your tags. My office will remain open. We will still be taking road complaints. We could be possibly doing some different things with some employees depending on what comes down the line, as far as if we need some help over at the food pantry or that type thing. Like I said, we're completely in uncharted waters with this thing. We're trying the best we can. We want to work with all of our other leaders, and we've worked well together. I talked with the mayor of Litchfield last night in the council, and they've put in some precautions also at City Hall. And Litchfield Police, I think they've posted on their website what their recommendations are, what they're going to do. So we recommend, if you have any questions for Litchfield Police, to call 259-3850. Clarkson Police and Caneyville Police, as far as we know, is on the same schedule. They will be answering calls, and I'm sure as this goes along, there will be some different screening processes at the jail. What we're doing now at the jail is because we have to really watch. If we catch something in there, we're going to be in big trouble, and so we're trying to really watch who comes in and out of that facility. So Jason has taken the extra precaution, is actually taking temperatures and doing things as the employees come in. So we're taking a few extra precautions there. I'm actually here in just a few minutes. I'm going to sign a declaration for state of emergency for Grayson County. That is, we have 0 cases at this time in Grayson County. There has not been one positive that we have had. We probably will, but at this time we don't. The reason for this is because we need to be able to tap into state resources, and we just need to go ahead and get this done, and it gives us a little bit more leeway on some certain things that we need to try to do in here for our community in Grayson County. So I'm going to go ahead and sign that after the meeting here, and that way it might help Josh try to get some equipment and medical supplies, could help our ambulance service with some medical supplies that we could possibly need, and I don't know that we'll be able to get them until this is actually done, so that is the reason for that. We don't want everyone to get in a panic. It's not because we have a positive here. We just want to, we want to be proactive and not reactive. A little bit about social media. I've got social media, and I just want to tell everybody in the community, let's use it in a positive way to try to help one another. I've seen a lot of people that's been negative about this, and I've seen a lot of people that's taken this seriously. And quite honestly, I didn't know what to think when it first happened. But I do know that I respect Dr. Lee enough and our medical staff enough and the people that's in charge of our state and our country that if they say we need to do this, we just need to do it. We need to hunker down and do what they say we need to do at this point to try to stop this. I beg you all to reach out to one another. There's been a lot of people, I've seen people post on social media that some of the parents are not equipped enough to take care of they don't know the homework. Quite honestly, I probably don't know some of my child's homework either, but there's teachers available. I've seen all over social media that they're willing to help. Only thing you got to do is call them, contact them. Well, I think you can even contact the schools, and there's somebody available there to help those folks that need help. So people has really stood out during this time. Try to refrain from anything political. We really don't need that right now, whether it be Republican, Democrat, Independent. I don't think that has a thing to do with this. I think this is just something that has happened, and no one here in this county, and quite frankly, no one in this country or state has ever dealt with. And we're just trying to make decisions as we go along, and if we all come together and try to come to the best decision, I think we'll all be a whole lot better off. And it is time to come together. The hoarding and stuff that we've seen going on here at our local, stores, please stop. We ask you, we've talked to Walmart, the Dollar General store. They are not going to stop delivering items. They're not going to run out, but I ask you to be patient with those retailers because they are trying. I know a lot of those folks that work at some of those places, and they are trying everything they can to keep the shelves stocked. And quite frankly, we probably need to remember them, remember the truck drivers, remember our first responders, remember our healthcare workers. There's a lot of people that if this turns out to be as bad as it has in other countries, that it could potentially get bad. And I use myself as an example. I've got a new grandson at home, and right now we've got a week's worth of formula. We can't get it because somebody has went in and bought 4 months worth. So that's the take. We're not going to run out of that stuff, folks. These retailers are going to continue to stock, and so let's be mindful of one another. Also, just don't panic. I mean, let's just not panic. I mean, it's no time to. It's very inconvenient for everyone. We don't know what's going to take place with this afternoon or the next hour, let alone tomorrow. So let's just try to just remember not to panic. I want to remind everyone also to remember local business. Local businesses are still open, and the drive-thrus are open. And I've got a printout for and I know we forgot somebody, and we apologize, but we've had a lot going on the past week and a half. But our local businesses, we've called them all, and the restaurants, and who's going to be open and who's going to be closed, and who's going to do drive-through only, who's going to do curbside pickup. I'm going to give that to the press, K105, and the rest of the news media here can publish that. That way everybody can see it, and it's along with their phone numbers too. And so, but we want to remember those folks. We want to continue to patronize those businesses because, quite frankly, folks, I'm worried about the economic impact that this is going to have also, not just the on the healthcare side. We need to we need to remember our local folks. We need to shop with our local people if we can. And other than that, I know there's a lot of things that we probably forgot, and we apologize. We'll try to update it as we can. If anyone's got any questions, feel free to call my office at 270-259-5000. We might not be able to take care of your problem, but we can definitely get you in touch to someone that probably can. So, media, y'all got any questions? Anything? Okay.
The question revolves around local businesses and factories.
Uh-huh.
What recommendations or guidelines should they take? I would just like to mention that COVID-19 website
Uh-huh.
is up to date and has that guidance.
Okay.
And it's kycovid19.ky.gov.
Okay. And the question was what recommendations do
Factories and local
for the factories and local business? And that was the question of what do they need to do. And basically you just need to follow that COVID-19 website, which I think our Grayson County website does not have a link to that.
Yeah.
Okay. You can get on gcky.org, and that's the website that we actually put up this past weekend. You can get on that, and that will give you recommendations on what to do and how to handle that as far as factory goes, and your local businesses and this and that. You know, remember, social distancing is probably the best thing. And I've had people say, well, what about the factories and this and that? And I hope that they're using precautions and put in place, and from my understanding they have been, and our local factories and things. And so, like I said, that's going to be changing. We need those folks to continue to go to work because that's how the economy continues to work. So we just want you to be mindful of other folks and just do exactly what what the CDC is recommending at this time. So I don't have anything else. Wayne, do you have anything that you want to add?
Couple follow-up comments.
Okay.
You know, I've been in healthcare 42 years. I've never seen anything like this coronavirus. It is so contagious. That's the problem, isn't it, Dr. Lee? And we need to do what he suggested, practice that social distancing. The most important thing is wash your hands often. And then, like Judge Henderson said, we're in uncharted territory here. And the reason for all these closings and things that we're having to do is to avoid that close contact with people to prevent that spread. And if we do those things, we can get out in front of it. And you've heard the governor and the president talk about flattening that curve. That's so that we'll have a chance to not overrun our hospital and our healthcare facilities across this country, and we'll be able to take care of our folks when they do show up with this virus. And it's not a matter, are we going to have someone, it's a matter of when and how many. With that said, I know there's questions out there about testing, and some folks have wanted to be tested. And how does that process work? Well, let me share a little bit about that. Now, if you think you have the symptoms for COVID-19, you have a high fever, you've traveled outside the area and so forth, then don't just show up in your doctor's office or the emergency department, we ask that you call first. Call your family physician first. He can diagnose those symptoms over the phone, most likely. He may have you come in to his office, but there will be precautions taken. He may want you to come directly to the emergency room. Call the emergency room first and let us know that so we can be prepared to meet you and give you a mask and that sort of thing so you don't expose others. If you just happen to show up, we ask, again, call first so that we can be expecting you. I ask that you be patient with our staff as we implement these new visitation policies. It's going to take a little extra time, and they're going to do it as quickly as they can. I wanted to mention that visitation times and times to come in to get your test will be different now. It will, you won't be allowed to come into the hospital until 7:30 a.m., and then we will be closing visitation and times to come in for testing at 5 p.m. If you were to come in and you met all the criteria to be tested, that's not a decision we make. We have to be in touch with Josh and the health department. They have to be in touch with the state to make sure that you meet all those criteria. Now, why is that so stringent? Because there is a limited number of tests in the state and in the country, but we want to make sure that we have enough tests for those that need testing to get the test. Josh, you want to add anything to that?
Not to that.
Dr. Lee?
Finish.
Okay. Last thing I'll say is reference the tlrmc.com website or hospital website. We'll post on there regularly any updates. We have links there to the CDC and other sites. Also, we'll be posting on Facebook and releasing press releases as things change. Thank you, Judge.
Dr. Lee?
I just wanted to add basically to what Wayne was saying. We're making a few changes at our office to try to meet this issue that we're dealing with. We're asking people, of course, to call. So we certainly, if you're sick, we want you to call before you get there so that we can, and some people are even having wait in the car till we have a room that actually we can put you in. We're going to be actually dividing our office in half, and half of the office will be seeing sick patients, and the other half will be just for our well patients and follow-ups that we have to see that are on medication. So they won't be any crossing between those two, but we have to have you call ahead of time so that we know what side you're going to be on. So it's really important that we do that. We will be as cautious as we can. We're all wearing masks in the office to protect ourselves because we don't know till we get people tested whether they're contagious or not. So we'll be continuing that process. The test number will be increasing. We've gotten some word this morning that there's another company that we may have a one-day turnaround time, but we don't have the material from them yet. So I think by the end of the week we're going to have more readily available tests. But right now we're still going through the process of the initial criteria, and that's exposure to somebody with the illness, travel to an area that was high risk, and certainly all the symptoms. So any questions about?
Josh,
All right, just real quickly, I forgot to actually take questions. So Rebecca, was you able to answer all those questions? Okay. Okay, awesome. The last thing I'll say is if you want additional information from the health department, we of course do have a website. That's graysonhealthcenter.org. Environmental Services also asked me to mention about the restaurant. issues with the state guidance that has come out to give instructions to restaurants on what they should do. And we actually released a document that came directly from the governor's office on our Facebook, as well as if you still have questions, please feel free to reach out to us at the health department, 270-259-3141. Yes, Rebecca.
Environmental is 259-8046.
All right, and environmental is 270-259-8046. Thank you.
Anybody else got anything? All right, I want to thank you all for watching, and I want to thank the ones for being here. We'll probably do this again. Like I said, it could change in an hour. We don't actually know at this point, so we're just going to follow what the state and federal government sends down to us. Like I said, I ask you to be patient with us. Please be patient with them. Quite frankly, I don't know that this has ever happened in history. I know we've had some Spanish flu back in 1912 or something that I'd seen, but I can't remember what the date was. But anyway, I mean, it was, we've quite frankly never seen anything like this. So I hope, and I've had people say, I think they're overreacting. Well, quite frankly, I hope 3 months from now we can say, yep, we overreacted, but we took care of the problem. So it's better to be safe than sorry. So, but I want to thank you all for being with us today. And also, if you have any questions, don't hesitate to call the respected offices of the leaders that's here, and you can also contact my office, and we'll get you in contact with the people that you need to get in contact with. Jeremy, do you have anything? Okay. All right. I thank you. Thank you all for tuning in, and thank you all for being here.